In July 2016, Dr. Kim and her team traveled to Haiti for a medical mission trip. The purpose of the trip was to provide medical services, mostly cataract eye surgery, to patients that might not otherwise have this opportunity. This is the story of that trip. Haiti is a small Caribbean country that shares the island of Hispaniola with the Dominican Republic to its east. It has an area of 10,700 square miles, roughly the size of Massachusetts. Its topography ranges from coastal areas to flat valleys to moderate mountain ranges up to 6,000 feet. It is about 680 miles southeast of Miami. The principal city of Haiti is the capital, Port-au-Prince, where the main airport is located. The medical facility is located on a compound operated by Double Harvest, which has had a presence in Haiti since 1978. We had a chance to tour the Double Harvest farming facilities and school grounds. Double Harvest is a nonprofit organization that operates agricultural, educational, and medical facilities in developing countries in different areas of the world. In Haiti, it grows food crops like corn or trees, tilapia fish farming, chickens and egg farm. The school was on summer vacation when we were there, but normally would teach up to 500 students of grades kindergarten through high school. Double Harvest opened its first medical clinic, providing health care for students, workers, and local villagers in 1988. And it constructed a more modern facility that became operational in 2004. These medical facilities are rented by and used by other nonprofit organizations such as Living in Faith, which operates an eye clinic with a permanent staff. Dr. Kim was volunteering with the Living in Faith ministry. The Living in Faith mission in Haiti is to provide basic optical care at a subsidized, affordable price, and in turn provide job and educational opportunities for students who have an interest in medical care. Living in Faith brings the healing gift of sight at several locations in Haiti. It is a ministry to improve the vision of Haitians so they can see the beauty that God has created. This was Dr. Kim's second trip to the Living in Faith Medical Clinic. A great deal of preparation started in January and February, planning what would needed to be brought and reaching out for pharmaceutical donations. We were planning to meet up with an ophthalmologist from Pennsylvania to utilize 2 operating rooms, each equipped with a phacoemulsification machine, microscope for the surgeon, sterilization facility, and basic hospital supplies. Dr. Kim relied on donated medical supplies generously provided by Allergan and Alcon, including a wide selection of artificial implant lenses, antibiotic eye drops, surgery packages for use with the machines, disposable instruments, hospital drapes, sterile saline solution, dilating eye drops, glaucoma medicines, and other general supplies. In all, we filled 4 large suitcases with personal items and about 150 pounds of donated medical supplies. We arrived in Port-au-Prince after dark on a typical Wednesday evening in July. Our host and founder of the Living in Faith ministry was Russ Montgomery, and he had arranged to meet us at the airport. We bundled our 4 large bags and carry-ons into a small car and rode for about 45 minutes outside Port-au-Prince past the smaller town of Croix-des-Bouquets. At the compound, we met up with other members of the medical team, Dr. Kevin Smith, and 2 operating room technicians that had arrived from Pennsylvania earlier that day. They had seen some pre-operative patients in the clinic that afternoon. We were glad to have an experienced operating room technician to assist Dr. Kim with surgeries and another qualified surgeon to review cases and surgery techniques. The clinic runs smoothly for surgeries, largely because of the work of Russ Montgomery and the day-to-day work of the clinic staff. Mr. Montgomery travels back and forth from Tampa, Florida to Haiti about once a month, He measures patients for glasses prescriptions and screens for glaucoma and likely candidates for cataract surgery. The surgery involves replacement of the dense and hardened lens with a clear artificial lens, the kind used commonly in the United States. The first evening we arrived was a time for taking a brief tour of the facility and the 2 operating rooms, and for unpacking the medical supplies and taking stock of what was available from the general supplies. Cataract surgery in Haiti is in some ways different than what was expected. The patients arrived early and were willing to wait their turn. We escorted them to the surgery room and tried to make them comfortable on a hospital bed. The patient was made as comfortable as possible. The eye was cleaned and prepared. There is no option for general anesthesia, so only a local anesthesia was available, injected by Dr. Kim behind the eye at the beginning of the surgery. Devon applied a local numbing eye drop from time to time during the surgery. Once the patient was fully draped and given the anesthetic injection, Dr. Kim used the microscope and handheld tools to create a small slice in the cornea so the working tips of the surgical tools could be used inside the eye. The idea was to use the power of the emulsification machine, a high-frequency sound wave, to break up the hardened cataract so that it could be fully removed. One problem we encountered was that many of the patients had cataracts of such dense and advanced degrees that the emulsification machine turned out to not necessarily be the best technique. Dr. Kim used, in some tough cases, a different technique, extracapsulation, that was removal of the cataract largely intact. A removed lens with cataract is quite opaque compared to a clear, healthy lens. Getting used to the machine and facility and having helpers who are new to the operating room made some of the surgeries a little slow at first. And given a late start, Dr. Kim was only able to complete 3 surgeries before lunch on the first day. But after that, the procedure got smoother for the surgery team, so we could see most of the patients scheduled for that day. After a surgery, a patient was wrapped with an eye shield so they could come back the next day for follow-up examination. The facility had a recovery room where the Living in Faith staff would escort them and allow them a couple of hours to recover before family members would take them home. In all, our team of 2 surgeons conducted 33 cataract surgeries and a dozen other procedures over 3 days. One minor procedure Dr. Kim did was a chalazion removal, where she was able to use the clinic as a teaching lesson for Mr. Montgomery and others as to how this procedure is done. Occasionally, a high school-age student might visit the clinic as well as an introduction to the possibilities of a medical services career. The Haitian patients were very respectful and appreciative. They would generally dress up nicely when visiting the hospital as a show of respect for the doctors. Most were very still and cooperative during surgery and endured the procedure well without complaint. The housing staff also provided meals for the visiting team: pasta, fish, eggs, and salad, some coming from the Double Harvest Farm. Simple meals that made us feel appreciated and meant we did not have to worry about food preparation after a long day. In the mornings, Dr. Kim would conduct the post-operative visits, preview patients for that day's surgeries, and also see some other patients who had come for problems other than cataracts. The examination chair did not cooperate by rising up, so we looked for a solution to this problem in a medical reference book. Russ Montgomery posts the word "panse" in his office, which translates to think in English and maybe nunchi in Korean. It is a reminder to the clinic staff to work through a problem in the mind, anticipating the things that can make a situation go better and the obstacles that might make it go worse. It is his unofficial motto for his clinic, a way to promote better service of Haitians serving Haitians. It was hard work for 3 days, but well worth the time and energy. We were usually very tired by the end of the day. The patients we met, unfortunately, we are not likely to see again. They will get follow-up with the regular staff and with other doctor teams rotating through. It was our privilege as professionals in vision care to have a positive and sometimes dramatic impact on people's lives in this part of the world. To allow others to see good things that God has provided for all has been a blessing.